Um, Hi, Kevin. Welcome. We still like you down there at CRMC, and we're glad you could join us. We're expecting more people to come in a little bit late-ish. It always happens that they seem to kind of trickle in at the beginning of the time. So let me get started by introducing myself. I'm Bob Wolverton, Program Director of the Northwest Regional Telehealth Resource Center, and I want to welcome you to our January edition of our monthly webinar. Our next webinar in February will be with Leah again, the same presenter we're having today. She's graciously offered to help us out again, and she'll be talking about pregnancy care with telehealth using teleconsultation and education. And we've been looking for something like this for a long time, so we're really happy that we're able to finally present some women's health issues too. I would like to remind you to join us at our 5th annual telemedicine conference in Seattle, March 21 to 23. The conference theme, Innovation Through Collaboration, and you see a link there for information. I'll go through our Adobe Connect room quickly here in my fancy green arrow. You can see who's here with us now, and that'll pick up as time goes on, I'm hoping. In the files pod down below, you'll see links to our save the date postcard and to the presentation today. That's the PDF you see at the top. So you can see the slides that we've got today. Down below that, the web links will link you to SurveyMonkey. We ask all our participants to tell us what they think of today's webinar, and even more importantly, we ask them to tell us what they'd like to see in webinars in the future, and we try to get them because we want to serve you and serve your needs. And then there's a link to the webpage for our annual conference in there too. If you have technical issues or technical questions, please enter them in the chat pod down below the arrow, and Martha and I will try to respond to them and answer them as quickly as possible and see if we can fix any issues that you might be having. Next to that, to the left, is a question and answer pod. You can, if you have questions for Leah, go ahead and type them in there. Leah has said that she will respond to the questions after she gets through the slides, because she's most likely to answer a number of questions as she proceeds through the presentation. But we'll keep an eye on that and make sure that all your questions get answered. And then there's just a little bit of a notepad over here that reminds you of pretty much what I've just said. So with that in mind, let me tell you about our presenter today. Leah Willis has held the position of Operations Manager for the University of Utah Project ECHO since May of 2014. Prior to this, she operated as Program Manager under the Office of the Chair in the Department of Biomedical Informatics at the University of Utah, and she served in managerial roles in the Department of Pediatrics, involving inpatient pediatric research, also at the University of Utah. Leah received her Master's of Science degree in 2005 from the University of Tennessee with magna cum laude status. Her professional background reveals an impressive ability to manage and coordinate complex departments and events successfully. On a personal note, Leah is from rural eastern Tennessee and remains active in all aspects of her life. She recently completed her first triathlon and regularly rode bikes in what little spare time she has. She's passionate about her time and remains active in the community through her participation as a volunteer in the Tour of Utah, independent wedding and event consultation, and with the Youth Mentor Project for the past few years in each event and group. And as if that's not enough, she's a brand new mom with a brand new perfect baby. So Leah, take it away.
Thank you so much. I am going to have to talk to Greg about where he got that all that information. But that's great. That is all true. And I would have to say my biggest accomplishment is probably the last one you mentioned. That is my 3-month-old son, who is of course perfect in every way. I always happy to answer questions about him as well. So Judy and Kevin and Nicole, thank you so much for joining us so far. Bob, I don't know if you can answer this question for me, or if our participants would be willing in the Q&A section perhaps to just write briefly, if you could just let me know where you're at and maybe what your title is. That would be exciting for me to know the audience, since it's such a small group. And Also, perhaps if you're familiar with Project Echo or not. So that's just down in that Q&A section down at the bottom. If you're willing, just to let me know where you're located, what you do, and whether or not you're familiar with Echo. So with that being said, I'll just get started here on the first slide. Project Echo at the University of Utah is we're a small group. Our medical director is Dr. Terry Box. He's a transplant hepatologist here at the University of Utah. He has been the medical director for Project Echo since its inception in 2011 here at the university. I'm the operations manager, as Bob mentioned. Thank you very much. And then we have 3 coordinators, Jordan, Greg, and Justin, and also Amber, who really run the show as far as making all of our clinics happen. And when you attend our clinics, you'll have lots of interaction with those 4. So just to let you know where Echo is situated at the University of Utah, we are part of telehealth services. So Echo is the educational and consultative division of telehealth at the University of Utah, and that is just by way of contrast. We're sort of positioned laterally from traditional telemedicine programs, which are the provider to patient programs. So for those of you who aren't familiar, ECHO is an acronym extension for Community Healthcare Outcomes. So, and I'll give you a really brief history. So what happened, how this project started was back in about 2003, 2004, in the state of New Mexico, there was a mandate that the hepatologists there aimed to screen and treat everybody with hepatitis C. And Dr. Sanjeev Arora, a hepatologist in New Mexico, thought, if we identify even 10% of the people here with hepatitis, we're not going to be able to treat them in the hepatology department at the University of New Mexico. We simply don't have the capacity to treat everybody. However, he felt very strongly that with a little bit of support, that hepatitis C could become a primary practice issue that could be treated at the primary practice level. Not to mention the fact that 80% of New Mexico's population lives great distances from their capital there in Albuquerque and would have to travel hundreds of miles in order to be treated. So he came up with this concept of ECHO, whereby the specialists at the university would video conference with providers around the state of New Mexico and provide to them consultation and education regarding hepatitis C and manage the patients locally, saving patients from having to miss work, drive time, only to get to to Albuquerque and spend 15 minutes being seen by a hepatologist and only to be told, you're doing great, keep going with your medication. So that is where ECHO was born. And the University of Utah was an early adopter of this model. We are also, as many of you who are in the sort of Mountain West and Western states know, it's not uncommon for there to be an academic medical center that is very, very far away for many of the citizens of the state. Certainly in the Intermountain West, we see that frequently. So we were an early adopter. We were actually the 3rd site in the world to begin doing Project ECHO after the University of Washington and, of course, New Mexico. And now there are about 60 sites around the world, including Ireland, India, Uruguay, many other countries that are considered hubs like we are. So the purpose of ECHO is to reduce healthcare costs and improve outcomes by expanding capacity to provide cost-effective, best practice care for common and complex healthcare needs of patients in rural and urban underserved areas. So I promise that will be the one slide that I read word for word to you, but just wanted to make sure that our mission is clear. We're not just, initially our thought was that we wanted to serve the patients that live far away. And then we came to realize very, very quickly that there are patients that are, within a 10-mile radius for whom care at the university is not possible for a number of reasons, whether that's a social or cultural factor that's causing a barrier, or financial factor, and additionally that there were many, many very hard-working providers out in the community that are really willing to take on these complex diseases, but they just don't have the support that is necessary to be able to do that. So at the University of Utah, our ECHO is aimed at focusing on underserved areas, whether that's rural or urban, in any discipline. So that would be a video that's about 80 seconds that unfortunately won't play in this format, but our website, which will be listed at the end of this presentation, has that video on it that just gives you a very, very brief overview of what ECHO is. Like I said, it's 80 seconds. That video it's a great video to show if you're trying to explain ECHO to other people at your institution. So just a brief overview of what we're doing here at the University of Utah. So our medical director, Dr. Terry Box, as I mentioned, transplant hepatologist. He is also the medical director for our hepatitis C and liver care ECHO series. So as you can see there, back in our early days when we first got started, it was a bit of an organic growth. You know, we started with hepatitis C, and then we found that there were other providers that wanted to talk about carcinomas. They wanted to talk about post-transplant care, etc. And so the liver care echo was born. And then that GI echo started shortly thereafter. And then our psychiatrist, who was involved in our Hep C echo, started a behavioral health echo, and sort of one thing led to another. Well, over the last couple of years, we've been a little bit more strategic in developing echoes by clinical area based off of the needs of the community. So many of our echoes were born from requests by the community and from state Medicaid saying, you know, these are the needs that we see. So we are always open to hearing your requests for what would be useful in your area. And whether we offer an ongoing series, which most of these clinical areas are, or offer maybe a quarterly event for you, we're very open to working with members of the community to meet needs. So I want to point out a couple of the echoes on there that might not be immediately apparent as to what they are. About a third of the way down, you'll see it says Med Peds Residency Echo. So what that is here at the university, obviously we're an academic institution. Our internal medicine and pediatrics residency group, they're kind of scattered all around the valley at various locations. And they have a monthly lunch and learn. One thing that they have, the way they'd handled that in the past is they would ask, Dr. Box, for example, can you go to, location A and present on hepatitis C this month? And can one of your colleagues go to location B and present that on hepatitis C? And so on and so forth. And so what we're able to do with the video conference with the ECHO is to get everybody together about every 6 or 8 weeks, and they get a presentation and they get an ECHO session in a different clinical area every single time. So we'll talk a little bit more about what specifically an echo is here in the next slide or two. And then I'm happy to come back to this slide and discuss in more detail what we currently offer and what's coming down the pipeline as well. So how does this work exactly? So we use video conferencing technology. It is basically just like FaceTime or Skype, if you've ever used one of those. Only what we use is HIPAA compliant. And we use that to do multi-point video conferencing, which is just a fancy way of saying that a lot of people are interacting at the same time. So rather than just being 2 individuals on video conference together, we will have, we could have a total of, 40 or 70 people on at the same time. Most of our echoes are a bit smaller than that, though. So the organization of each session includes, at the beginning of each session, there will typically be a 10 to 15 minute didactic presentation related to the particular clinical area of the echo, followed by case presentations from our community providers. So the community providers are presenting cases that they're currently working on and getting consultation and feedback. And one of the great parts about ECHO is that everybody gets to see everybody else's presentations and hear their consultation. So you're learning not only from your presentation and from the didactic, but also from the experiences of those in the community around you. Because this is case-based learning, we are able to offer Category 1 CME credit. It's based off of how long each particular echo session is. So it's usually 1 to 1.5 hours of credit per session. And we do offer this at no cost. So that is an image of what an echo typically looks like. So you can see there we have a Utah Project Echo on the left, and then we have the presenter on the right. And we just bop around through the various people until everyone gets a chance to present their patients and gets feedback. So this is another view of what an echo might look like. So in this case, you'll see there that we're doing a didactic presentation. And then you can see the providers and various participants there over on the right. So the general process for participating in an echo might be that you would identify a patient for whom you would like to have consultation from a specialist group, and then we will give you a code so that you can assign a unique ID, so the patient will be de-identified. We also provide you with a case presentation form. These are short forms, usually about 2 pages, and those forms will provide for you not only guidance on what information is specifically needed for the specialists here, but also they provide a nice outline of what information you'll share when you give the presentation. It is also possible to send along imaging, which we can then load into our system and go over as a group during the echo session. At this session, the patients get presented to the group, recommendations are received, and then the written recommendations are scanned or faxed back to you so that you'll have documentation of that. From time to time, we do ask that many providers choose to come back and get follow-up consultations on patients. We do ask that we get follow-up so that we can track outcomes and understand how these patients are doing and make sure that they're doing just as well as the patients would be doing if they were being seen here by specialists directly. So that image there, the case presentation forms, it's a little bit of a smaller image, but just to give you an idea, they're just very basic sort of H&P information that is specific to the clinical area in which you're seeking consultation. So I like this graphic just because for someone who maybe hasn't participated in an echo session before or this kind of group teleconsultation, this gives a nice excuse me, a nice graphic for comparing what traditional telemedicine or referral can do versus echo. Now, of course, there is definitely a place in the world for traditional telemedicine and for referral. For example, a patient having a stroke in an ER 400 miles away from a major facility, excuse me, they don't need their ER physician to present at echo on Friday. They need help now. And so that's where telemedicine is extremely successful. So whereas with echo, there's an interdisciplinary team typically of providers on one end, community-based teams or individuals who log on together. And like I said, with the knowledge that you gain, you can not only treat the individual patient that you're presenting, but also similar patients in your practice. So in this particular graphic is just showing where many of our current spoke sites are. So those are the sites that are logging on and presenting patients. We're just showing the western contiguous U.S. here, although we do also have participants as far east as Nebraska. So many have asked who participates in these sessions, and I would say there's a wide variety of participants in these sessions. I would say most common would be MDs, NPs, and PAs. We do also have pharmacists and nurses that participate regularly. Additionally, we have genetic counselors that come specifically to we have a session on identifying and managing patients at risk for cancer. Both specialists and generalists attend, and then Participants come from a wide variety of facilities, from FQHCs, private practices, Indian Health Services, hospitals, and other residency training programs. Oh, I suppose I lied. This will be the second slide that I'll read to you directly. So we do regularly evaluate our service. A recent piece of feedback that we received, I thought it was amazing. It was very high yield and full of learning. It was also nice to pick the brain of consultant with a case and see what the nuances of what he was considering and thinking about. So I think the point that I liked that this participant made was that, excuse me, that the learning is very high yield, that it's a very efficient learning process, and that I think that the success of the program lies in not only providing that very brief and focused didactic base, but really emphasizing case-based learning for on current cases in current practices. So what we hope to achieve in Project ECHO at the University of Utah is providing what the university refers to as the exceptional patient experience outside of the four walls of the university. And, excuse me, how we know that we're able to do that is through, like I said, evaluation and following patient outcomes. And so you may have read in 2011, there was an article published in the New England Journal of Medicine validating Project ECHO as a successful method of treating hepatitis C. Similar studies are underway in the other more recently added clinical areas. The New York Times and Forbes magazine have also recently written about ECHO. And then we here at the University of Utah had a brief report in the CDC's MMWR that was replicating the original New England Journal the New England Journal article. Many people wonder, do I need video conferencing equipment in order to participate? And the answer is no. That your laptop is sufficient, along with an internet connection, and then we provide you with the HIPAA compliant software that's required at no cost. Excuse me. Having a webcam is obviously a critical feature. Most laptops have webcams. If you would like to be visible on the screen, which we hope that you will be, there's a lot of value in being able to see each other face to face. However, you can also participate just by calling in on a telephone. So, second most popular question was, what does it cost? There is no cost to participating in University of Utah's Project ECHO. We do provide the video conferencing software that's necessary, and CME credits also are at no cost. Excuse me. One thing that we do ask is that, well, I'll skip to the next slide, it has more detail, that you make a little bit of a commitment to us, and that would be to complete and submit case report forms in a timely way when you are choosing to present. And what that means is we just ask that the report forms be submitted to us a day or two in advance of the session at which you'd like to present. And that gives our mentors the opportunity to review your case in advance and be prepared. You can attend as desired. There's no attendance requirement. So if you attend for 3 months and then drop off for 2 months, that's fine. If you only come to every other session, that's also fine. Maybe you've only got 1 or 2 patients you'd like assistance with right now, that's okay too. Or perhaps you don't want to present any patients but would like to come, learn, and receive CME credit, and that is also okay. Oh, you'll have to excuse this incessant coughing. I'm just getting over a little bit of a cold. So what would happen next if you have an interest is just my contact information will be at the end of the slide, and then also Bob, if you'd like to forward that out to the group, I'd appreciate you sharing that with them. So what we could do is just add you to our listserv, and then we'd send you an email that just gives you our current schedule and instructions on how to download the free software, and also how to present a patient. So just by way of summary, we're moving to the echo model of consultation is, in my mind, a similar sort of development as moving from paper charts to electronic charts. It's an efficiency that is allowing us to support more people further away, allowing for greater access to best practice care, and increasing the capacity of health systems to manage patients. We're able to do this in a very cost-effective way, decrease disparities in healthcare for patients. Many of our providers appreciate the opportunity to interact with other professionals, so reducing professional isolation, and then ideally reducing inappropriate or overutilization of the system. So in addition to these traditional echo series that we offer, our mentors, and particularly our medical director, are also available to travel to your site to do grand rounds and CME presentations. They can give an echo demonstration, or perhaps even have the group join a live echo. We do this for echo presentations at no cost. So if you have an interest in having one of our faculty come and present on pregnancy care, for example, we can organize that for you. We also can send out our coordinators to go over with you how to use the software, address any minor tech issues with you, and get you in contact with tech professionals if necessary, so we can help you get all that set up so that there's no barriers there. Excuse me. And then we do frequently do conference talks as well about the echo model. So that is just a rather quick presentation of the echo here, and I would be more than happy to answer any questions that you may have at this time. And I see there at in the chat area, Greg has listed our video, and then you can reach out to Bob for my contact information. So I see there from Kevin. Kevin has asked, what software is provided to join by video conference that would be installed for providers? Right now we are, some of our sessions are using Jabber and some are using Akano. We're also looking at, we're moving towards using Akano and or VidYO, with video, which are, as you may know, more user-friendly than Jabber. But right now the majority of our sessions are using Jabber. Any other questions? I see, it looks like there might be another one coming in. And I would just like to also point out to you that I'm going to go back to the slide that has our current offerings, and just so you know, our specific schedule for when all these sessions are offered. They are regularly scheduled. It is listed on our website. Other questions?
So if you're interested, ask away.
Yes, I did get through that presentation rather quickly. I can absolutely talk some more about echo if you'd like. So, one I can point out as well, one of our unique echoes that isn't offered by any other sites is that we do right now nursing education as well. So those sessions are geared specifically towards nurses, and we do have the capacity to respond to specific educational needs that your nursing staff may have.
Leah, we've got a question from Judy. We've got a question from Judy.
Let's see, on my screen I see Judy is typing, but I don't see the question just yet.
Okay, I'll just go ahead and,
Oh, let's see.
Judy asks, what are some of the main tasks that need to be completed behind the scenes for each session?
So the main tasks from the participant point of view would just be if you would like to present, then you would fill out the case presentation form and send it in. And that's the extent of preparation. So once you have the software downloaded, and we can help test it with you to make sure that everything is working well. Once you have the software downloaded, it's the same process to join any of the Echo sessions, just about. And so you can just log on to any session and present a patient. So if you're not presenting a patient and just want to attend, then there is no preparation. You just show up, much like you would if you were going to a grand rounds. And I would absolutely encourage anyone who's interested to get an account with us. And so you reach out to us and we'll get you set up with an account for the free software, help you get the software downloaded. And then I would encourage you just to pop into any of the sessions and just feel free to observe if you'd like to see if it's useful, valuable for you. What are the administrative tasks on our end? Looks like another question has come through. So are you asking, Judy, what it takes to be a hub? I'd be happy to share more information about that. So what we're doing on the back end for these sessions, is that your question? Well, I'm not sure if that's Judy's question or not. So I'll just speak to that for a moment. So on our end, so as I mentioned, there are echoes around the world now that are considered hubs that are hosting these sessions. And there are others in the NRTRC, including the University of Washington, as I mentioned, as a well-established echo. Some of the other states have echoes also, and in some of the states, the spokes must be a member of that state. So for the University of Utah Echo, you do not have to be in Utah to participate. So we have on our end a rather lean team compared to many other echoes. So our coordinators each manage multiple echo clinics. Often you'll find it's one coordinator to one echo. So on our end, I feel really lucky to be working with such an incredible team. So on our end, let's see, Judy says, referring more to the specific tasks that need to be done before each session. So on our end, what we'll do is we'll receive the case report forms. We create an agenda so that both the participants and the mentors know the schedule for the session. Then we take those case report forms and we create these mini, what we call shadow charts, that our providers can use to review the cases. And that way we can, if you provide follow-up for patients, we can keep all that information together. We also take all of the patient data and we put it into a database called REDCap. And that database allows us to pull information about patient outcomes and also to characterize what types of patients are being presented. Let's see. Additionally, we're scanning and faxing recommendations back to sites. Basically, just the typical paperwork that you might think of in a clinic setting. Let's see. Judy is typing a little bit more now. Oh, perfect. Okay. So if you have an interest, Judy, or anyone else, and would like to talk in more detail about how we coordinate these sessions and what specifically goes into that, I would be more than happy to share details with you. And I also would invite you to come to Salt Lake City, and we'd be happy to show you what we do. If you have an interest in being a hub or in hosting sessions, we'd be more than happy to share how we do it here with you. Other questions? Oh, you're very welcome, Judy. Other questions?
If we don't have questions for Leah coming up soon, we will invite you to take our survey and let you know what you thought of today's session and give us some ideas on future sessions. I will remind you that next month Leah will be back presenting on managing pregnancies via telehealth. So, seeing no further questions coming up and nobody apparently typing, Martha has given you the survey. Please take that. And Leah, thank you very much for joining us. Hope you get over your cold, and we'll see you next month.
Thank you so much, Bob. And next month we'll do a little bit deeper dive about how the echo works and about the issues that we're managing, women's health issues that we're managing in our pregnancy care echo session.
Sounds great.